morning, ladies and gentlemen, and welcome to the Thurston County Commissioners Work Session. This is budget today for October 14th, 2020. And I'm John Hutchings, the current chair of the board. And we have Vice Chair Commissioner Ty Menser, and we have County Manager Ramiro Chavez, and we also have PHSS Director Shelley Slaughter with us, and a host of other folks. And so I'm going to turn with a reminder that we did a budget all last week and on Monday and today. And it is said that money is only a tool. It will take us wherever we wish, but it will not replace us as commissioners as being the drivers. So we need to be very deliberative in what we do and the decisions that we make. And so with that, I turn to you, County Manager, to please introduce other folks that I have not seen on the screen on the Zoom.
Thank you, Commissioners. This morning you have a Public Health and Social Services budget briefing that will go from just about now to 11:30. That is the schedule. There is a break built in between 10:15 and 10:30. And in the afternoon, you have no budget briefings. The budget briefings that were scheduled for the afternoon, those have been moved for Friday morning. And as I mentioned in my report yesterday afternoon, there is a block of budget briefings for Friday afternoon, and that is just in case. I don't think we need them, but we will cancel those by tomorrow if that is the case. But again, it's today, in the morning, as well as Friday in the morning, and that will probably end phase one of the budget deliberations. So with that in mind, here's Shelley with her staff. Let me see if I can scroll through the screen to see who's here.
And we have Robin joined us, Assistant County Manager Robin Campbell.
I should just join us. Thank you.
Yes, good morning. Thank you for taking the lead on that, Ramiro.
Right, we have Commissioner Edwards just joined the room. We have Robin, we have Marsha Boyle. Let me see if Corny Monson, is that correct? Then we have Art Story, we have Olivia, Patty, Tom Webster, Jenny Knight, I believe, Mark Muffet, and that's it.
And Olivia and Art Story. Yeah, good. Okay. So who's going to, are we turning it over to Robin?
Shelley.
Shelley, okay.
Shelley can take it away.
Okay, great. Thank you so much. Good morning, Commissioners. It's my pleasure to be here with you this morning, along with members of our executive team and fiscal staff that are here to help answer questions that you may have as we go through the presentation today. I want to start out by giving a special thanks to the Budget Office for your incredible help to us as we prepared for this presentation and supported us in getting all the materials together. So with that, I'm going to go ahead and get started here. Let me figure out how to advance through my slides. Okay, so Thurston County Public Health and Social Services is one department with two really important components, both public health and social services. Our department's responsible for protecting the health and promoting the well-being of all people who live, work, and play here in Thurston County. And our mission's working together to achieve the highest level of health and well-being for everyone. We are one of 35 local health jurisdictions governed by our local Board of Health. And we are part of the state of Washington's governmental public health system. We carry out a wide variety of programs and services to build healthy communities, and I'm going to share more about that as we go forward into this presentation. We are also one of 16 local health jurisdictions and counties that have a combined public health and human services department, which here in Thurston County we call social services. We provide services for all Thurston County residents, including our local our entire county, including our local towns and cities as well. Last year, we embarked on a 5-year strategic plan, and you can see here on our screen, we had 5 strategic priorities: achieve organizational excellence, advance equity, protect human health, promote healthy behaviors, and support well-being. For 2021, we're proposing a $40.6 million budget with expenditures that include 120 employees. Our employees are the heart of the work that we do, and we're so proud of the incredible work that they do. And you'll see as I go through all of the programs and services, it's pretty amazing what we're able to accomplish in our 6 divisions that include 7 different funds. So I know you are all very familiar with many of the different programs and services that we offer, but I just want to highlight and provide a little bit more detail about these programs. So our largest division in our department is what we call the Community Wellness Division. That includes 4 different key programs, and I'm just going to share a little bit about what each of those programs do. Our Developmental Disabilities Program is funded by millage, and it is part of Fund 1500. I'll go through the funds in a little more details later, but I just wanted you to have that as a reference where it fell into. Our Developmental Disabilities Program is the largest program within the Community Wellness Division, and it provides youth and adults with developmental disabilities with opportunities for education, training, and workforce development. We partner with a variety of community programs and contract with various nonprofit organizations to help improve the lives of those in our community with developmental disabilities. Our specialized recreation program also serves those with both physical and developmental disabilities and provides really important opportunities for social connections and recreational opportunities that help to provide support for their families that care for them, and also provide opportunities to develop and grow, work, learn, and play here in Thurston County. Our Education and Prevention Program was recently renamed. Formerly, it was called the KEEP Program. Provides a variety of different services, one of which you got to hear about last night in our Board of Health briefing on tobacco and vaping. So tobacco and vaping prevention programs, our healthy eating programs, our active lifestyle community design programs, and many other programs. Our maternal child health program has 3 different components. Our nurse family partnership program is one of the largest of our maternal child health programs. It's an evidence-based program partnering community health nurses with high-risk and vulnerable mothers and children in our community. An important part of this program to know is that it serves multiple counties, including Lewis and Mason County as well. Also part of the maternal child health program is our Children with Special Needs program, which provides nursing consulting and support to those with children with special needs. We also provide child fatality review and provide support for our Thurston Thrives action teams focused on child and family wellness. Any questions so far? Okay, I'm going to keep going. Also part of our Community Wellness Division is our Veterans Assistance Program. That is a different fund, although it's part of the Community Wellness Division. And the Veterans Assistance Fund provides support to indigent military veterans and their families with a variety of different support services and financial assistance programs that help provide basic needs such as food, housing, rental support, burial costs, utilities, and other basic needs. We also partner with the Lacey Veterans Hub to provide coordinated and collaborative support to veterans in our community. I'm going to cross over here to our disease control and prevention program. That's also part of our Fund 1500. And there's many components in many programs, part of the disease control and prevention division. Our syringe services program provides syringes, education, and testing and support services to those who may use injection drugs in our community, with the goal to help to prevent disease and to provide connections to treatment and other resources in our community. We offer both mobile and a fixed site service in our syringe services program, located in downtown Olympia and then throughout Thurston County. Our opioid response program is one of our newer programs that you approved in our last biennial budget. And we're really proud of the work that has happened in response to the opioid crisis we're experiencing here in Thurston County. We have hired an opioid response coordinator, Katie Strozik, who leads the work on this program and leads our opioid response task force. The goal of this program is to prevent opioid misuse and abuse and provide prevention and education to help prevent overdoses and provide connections to treatment in our community. Another really important part of this program is our epidemiology and assessment. So having good data and being able to follow trends and track not only diseases, but the overall health of our community is really foundational to public health and social services. Many of you have seen the different data presentations that our senior epidemiologist, Marianne O'Garrow, prepares for the community and frequently presents on. And the data really drives the programs that we offer, the services, and helps us to improve the health of our community. Our investigation and control of disease program is a small but mighty team and growing due to COVID response. And part of that role is really to control and prevent the spread of infectious disease and preventable diseases through programs such as Vaccine for Children and other programs that help to educate people on how they can protect themselves from diseases, as well as controlling the spread of those diseases by investigating notifiable conditions. So the state of Washington has over 100 notifiable conditions. You heard a little bit about that in our Board of Health report yesterday that our health officer, Dr. Abdimalik, shared about just how much work it takes to be able to investigate all of those cases and make sure that we are doing everything that we can to protect the health of our entire community. I want to just insert a note here about COVID-19 response. As you know, we've been in a pandemic for over 250 days now. Our incident management team has been activated and our continuity of operations plan has been activated. We've had over 50 of our existing staff helping to support the COVID-19 response. I'm going to talk a little bit more about that as we move on, but that has become an absolutely essential part of the investigation and control of disease program within disease control and prevention, and we expect that to continue to grow in 2021. Any questions?
Kelly, are you going to go into how enmeshed you are as PHSS into Thurston Thrives?
Yes, I can talk about that a little bit more.
When it's appropriate, yeah.
Yeah, great. Thank you so much, Commissioner Hutchings, for asking about that. When I was reviewing our community wellness division and the education and prevention program, that's where a lot of the work of Thurston Thrives falls under. So we support 8 different action teams that promote the social determinants of health here in our community. So those action teams include law and justice, housing, economic support, environmental health, community design, and climate mitigation, partners for children and families, that name's changed a couple times, and many other action teams that are part of our Thurston Thrives effort. We're both a funder and leader, and the Board of Health sponsored Thurston Thrives and the start of it probably about, 7 or 8 years ago now. And we continue to support our community in that work. And it's a way that really has helped that collective impact initiative and effort has really been a core part of the work that we do and helped to improve the health and well-being of everyone in our community, including our health rankings here in Thurston County. Have any more questions about Thurston Thrives and our role with Thurston Thrives?
Commissioners, any questions so far?
No, sir.
No? Okay.
Great presentation, I might add.
Thank you, Commissioner Edwards. All right. So moving on to environmental health. So that is a different fund, 4520, and is one of our foundational public health programs that we provide here. There are several different RCWs, WACs, and statutes that guide the work of this division, and it's nothing short of amazing what our second largest division in the department accomplishes. So some of the programs of environmental health include our on-site sewage systems permit and application and regulation programs. I should also note that we operate out of 2 different buildings. So part of our programs are offered at the Lily Road building, where our public health department is located. And then the other is in joint co-located with community planning and economic development in the building development center in building 1. That's where our on-site sewage programs are located. That is also where our drinking water lab is located. We operate the largest drinking water laboratory in our region and provide support to other businesses, communities, and other local municipalities to test and monitor drinking water quality here in Thurston County. We also have our water quality program that operates in part out of Lily Road here, and that includes both our surface and groundwater water quality. We monitor lakes and streams, as well as our waterways, shellfish, recreation areas, and others. We also have our solid and hazardous waste program that provides monitoring and compliance of solid and hazardous waste, responds to complaints, and ensures that our ground and water is safe from hazardous materials. Our food environmental services program, we commonly refer to that as food, schools, and pools program, and that's because as part of our role and statutory responsibility is to inspect and monitor all food establishments here in Thurston County. So there's over 1,000 each year that our team inspects to make sure that the food that we eat is safe and provide education and support to our food establishments. We also provide services to our local schools to ensure that they're safe for the children that are at the schools playing and learning. And also we inspect our water recreation, public pools, and other water recreation facilities. I'll pause there to see if you have any questions. And our Environmental Health Division Director, Art Starry, is also online here if you have any questions about environmental health programs.
Question about enviro health?
Well,
No.
I'd like to make sure, Shelley keeps asking if we have questions. I'd like to assure her, at least from my perspective, that she's doing such a good job explaining all this that I don't have questions. So I think this ought to be taught in civics class myself.
All right. Go ahead, Shelley.
All right. So our Office of Housing and Homeless Prevention is another fund. It's 1,400. It falls under our department 41 Social Services Department, and provides funding and leadership to promote affordable housing and to lead our homeless response efforts here in Thurston County. I know that you heard a great presentation by our homeless response coordinator, Keely Marino, yesterday, and she provided some information about some of the great things that have been happening in that program. So with the Board of Health declaring homelessness a public health emergency, this program has grown and provides the core funding and support for the majority of our affordable housing and homeless services here in Thurston County. Our Vital Services program, also in Fund 1500, one of the most important aspects of Vital Services is that Thurston County, since I think about 1910, is the local registrar for birth and death certificates. So that is a service that we are required by statute to provide, and we're very happy to do so every day here at Lily Road. In this division also is where the exciting fiscal services and budget oversight happens. We have an amazing team, two of which are here on this call today, that help to ensure that we are fiscally responsible and accountable. We also have a fabulous administrative services team that helps to make all of these different programs and divisions work together and provide support to the public. And then our public health emergency preparedness and response team helps to prepare for various types of public health emergencies, of which we have been in one now for almost the last year. So we're very grateful to that team for helping us to respond to this emergency now and preparing for things that might happen in the future. With us being located in Thurston County, the seat of our state government, we have additional responsibilities within that program that are unique to Thurston County and our department, because we do have jurisdiction over the state capitol. And then finally, our treatment sales tax program, as you know, is a 0.1% sales tax program that provides funding and support to programs that provide mental health and treatment, substance use treatment services, such as our therapeutic courts and many other programs. You're going to be hearing more from treatment sales tax, which is new to our department in the last 3 years, and we're really happy. It's been a very complementary fit to have treatment sales tax join us, but that will be a separate presentation that you'll hear more of on Friday. What you will hear in the presentation today is, while treatment sales tax provides funding to many behavioral health and treatment programs, to include programs offered by Public Health and Social Services. So you'll see in some of our requests that they relate to treatment sales tax. And I think we have Carrie Hennon that is on this Zoom today if you have any questions. Okay, I'm going to move forward and talk a little bit about our expenditures here. So our department has really grown in the past few years. In 2019, we had a really strong year. We were going through some reorganizational adjustments due to the Thurston Mason Behavioral Health Organization being formed and leaving our department. And that really helped us to realign and kind of restructure the various services that we have, and also to achieve new funding sources and pursue new programs. We've been really successful in our grant efforts. I should note that approximately 80% of our department is funded by grants and contracts, which makes us unique in some ways to other departments and offices in the county. In 2019, we had 107 FTEs. That accounted for our $9.8 million in personnel costs. As you know, our personnel costs are tend to be the highest part of our expenditures, and our people are our most valuable asset. So in 2019, our budget was about $29 million. So when you look at 2019 and how that compares to 2020, you see some significant changes there. And so you may be wondering, why is that? And a big part of that is due to the COVID-19 pandemic that occurred in first quarter of 2020. While we still had our 107 FTEs, many of them have been deployed to the COVID-19 response. We've also had to hire over 30 temporary employees that accounted for increased personnel costs in 2020. By the time we get to the end of 2020, I expect we'll see even more of that. We also received, as you know, and thanks to you, additional funding that really prioritized our work in public health on the COVID-19 pandemic response. So that $34 million is reflective of additional revenue that we received through the CARES Act funding, through the CARES Act fund, as federal funds, as well as funding that we received from the Washington State Department of Health to help us respond to COVID-19. Which makes us at about 47 million halfway through 2020. In 2021, you're going to see kind of our best guess here. We took a conservative approach to what revenue we expect, and I'm going to go over revenue shortly here. But in terms of our expenditures, we have significantly more needs, not only due to the COVID-19 pandemic, but because of some of the other successful grants we've achieved, as well as addressing some of your strategic priorities, as well as meeting the needs of our community. So we have an increased need for personnel to accomplish the foundational public health work that we do, as well as addressing the great community needs that we have. And I'll be going into more details about that as we go through our policy change requests. So our personnel costs,
Shelley?
Yes.
I've got a couple of questions. Go ahead, Ty.
Well, I thought Shelley was done with this slide. I'll wait till before you leave this slide, I have some questions, unless you answer them.
And I'm on this slide as well for my questions. Gary, do you have any questions on this slide?
No, I do not. Not right now.
Go ahead.
I'll listen to you guys.
Let us know when you're going to transfer on.
Okay. Well, I'm just about wrapping up this slide. You can see that we are anticipating about $40 million in expenditures in 2021. And I will say that when we prepared this slide and these projections, that was approximately a month ago, and it's amazing how much can change in 1 month in terms of funding. We are anticipating that Congress and the legislature will be appropriating and granting additional funding to public health in 2021. And so we do expect that there'll be some significant changes. We also, with some of our programs, such as environmental health, which is primarily a fee-based program, and some of our other tax-based revenue programs, we have been applying a cautiously optimistic, a little bit more conservative perhaps than maybe some other departments in terms of what kind of revenue we may have to continue to do this work. So, but we believe that these expenditures that we propose are reflective of what we anticipate the needs to be now, and we may see more in 2021. I will pause there because it sounds like you have a few questions.
Go ahead, Ty.
Just to make sure I understand the numbers. So because on the surface it doesn't make sense, but I think I understand. I think I know what the answer is going to be, but I just want to confirm. So in 2019 to 2020, personnel costs are up 3.5 million, but your FTEs stayed the same. So that was all temporary hires or something that don't play into the FTE number. Is that why there's that difference? And then looking to 2021, you add 13 FTEs, but personnel costs go down. So I just want you to kind of flesh out why that looks that way that it does.
And that was exactly my question, yeah.
And that was exactly my question when I was looking at these numbers too. So I anticipated that you would ask these because I was also wondering the same thing. That you are correct that the changes in personnel costs, the fluctuation there really has to do with our COVID-19 response and those temporary employees in the second quarter of 2020 there. So that is correct. And then if you kind of look at the difference between the 100 in 2019, the 107 FTEs, and again, this is both for public health and social services personnel, the costs are about 9.8 million. For those 13 additional FTEs proposed in 2021, that's pretty consistent with costing us a couple million more dollars there. Marcia, is there anything that you would add to this?
Good morning, commissioners and everyone else.
Morning.
This is Marcia Boyle speaking, and Shelley summed it up fairly well. What happens in the budgeting process, we don't really add FTEs. We add it under a line called extra help. And so we put a lot of extra funding there, knowing that we were hiring a bunch of additional part-time or not full FTEs. And so it's put into a category that doesn't hit our FTEs, but it does hit our personnel costs. And then for 2021, there would also be an increase due to any type of COLA that was committed to or built into the collective bargaining agreement.
Thank you for that addition, Marcia.
You're welcome.
Robin, is there anything that you would like to add or ask?
I'm just clarifying question, and that is, does 2021 then assume FTEs that are they're temporary for this year and are meant to be part of the COVID response?
Only 2 of the proposed FTEs in 2021 are associated with the COVID-19 response. And I'll explain that as we go through our policy change requests.
Okay.
I will say, Marcia, go ahead.
There is also in the 2021, pardon, this is Marcia again. There is one FTE that's a temporary FTE in 2021, and it's to, Shelley will get to this in the policy request, is to accommodate some retirements and changes in the food program. So there is a temporary FTE built into 2021 here.
Oh, thank you. Yes, we did have one temporary.
Okay. Well, I'm sure that we'll hear more as we go that'll help clarify this. But I think the thing that you said that makes the most sense is that 2020 has a lot of money built in for extra help. A lot. Marcia, it might be helpful if you could put a number on a lot. And we don't need that in the moment, but yeah. So Shelley should continue unless commissioners have additional problems while you look that up.
Well, we don't have time to go into all my problems. But I'm just trying to still figure out between 20 and 21, we're increasing 13 FTEs but the budget's decreasing by $1 million. That's because we're planning on
So
getting rid of camps?
that's what Marcia's looking up, Commissioner, is why, just how much of that 13.5 million in personnel costs is for extra help.
Okay.
Because if that number turns out to be like $2 million and the extra help is anticipated to end at the end of this year, that will explain why there's
would.
such a big drop, even though money's coming in. So she's going to look up how much is added for extra help, and we're going to sort out why
Okay.
it looks the way it does.
Hutch,
Yeah.
just for clarification with Shelley, all the change in the numbers in 2020 all has to do with the CARES dollars, the whole pass-through thing, isn't it? And directing towards this COVID deal.
Yes.
That's what it's all about. I'm just saying that for the public who are watching, so they'll know we just didn't, make up some money. We got a lot of money in from the government through the CARES program. I don't know the total figure right off the top of my head, but we got 2 different allotments, and it was a lot of money.
He'll address that, I imagine.
Yes, we'll talk a little bit more about revenue, but yes, roughly about $13 million in additional funding coming through our department through the CARES Act and other funds by Department of Health for COVID-19 response in 2020. 2020 is going to be a really special year for us as we try to navigate COVID-19, and then we're kind of in a new world going forward, and we don't know what quite is ahead of us yet.
Thank you.
Okay, press on.
Okay. Here's where we can dive a little bit deeper into the various funds. So again, treatment sales tax, you're going to have a comprehensive presentation on Friday afternoon. But this is part of our public health and social services budget. TST falls under our Department 40. And so I will just highlight this for you, and then knowing that, again, you can get more detail on Friday. But the beginning fund balance for the what we call the TST program is about $4.7 million in 2021. And you can see that we have estimated revenues of $6.4 million for treatment sales tax. That is likely to go down due to COVID-19 and the economic challenges that our community is facing. There are expenditures proposed of $9.1 million for various programs, both that include community as well as county office and department funded programs that support behavioral health and substance use treatment here in Thurston County. As you know, there is an advisory board of which you appoint that reviews funding requests each year and makes recommendations to you. The Treatment Sales Tax Advisory Board has met and reviewed all of the requests for funding. And on Friday, you'll be hearing more about what the advisory committee is recommending that you fund this year in order to maintain a sufficient fund balance estimated to be about $2 million. Any questions there?
Yes.
Okay.
Hutch, is that okay? For 2019, how many dollars did you bring in on treatment sales tax? And is that a county-wide fund or not? The cities are not included, just for the public.
It is a county-wide 0.1% sales tax. So it does come from the entire county. And I can pull that up for you here.
Kelly, I know that off the top of my head if you want.
Go for it, Carrie.
Good morning, Commissioners. Carrie Hennon. So 2019 revenue for treatment sales tax was about $6.4 million, which also happened to be the expenditure amount. Our expenditures and revenue in 2019 were almost exactly the same.
And what was so far on 2020?
So far on 2020, we are actually slightly up from 2019. And again, we can talk about this more at the presentation on Friday, but earlier in the year, we had been talking about looking at a decrease in revenue. When I did projections, it's actually going to show a little bit different than what this shows in this slide deck. So I, in my presentation, assumed revenue for 2020 would be the same as 2019. So I'm going to show you a slightly higher estimated beginning fund balance.
But what was it so far? I mean, what have we collected so far in 2020?
I don't know off the top of my head. I can bring that number on Friday, or I can probably, but it is slightly up year to date from where we were in 2019.
Yes. Okay. Thank you.
Robin, did you have a comment or question? Okay, I'm going to, thank you so much, Carrie. I'm going to move to Fund 1200, our Veterans Assistance Fund. Wonderful program. And the manager of that fund, Mark Moffitt, is also on the line in case you have detailed questions that I'm not able to answer as we go through Veterans Assistance Fund. But again, Veterans Assistance Fund provides support to indigent veterans. By statute, there are requirements as to eligibility, as well as what types of funding and support can be provided to veterans in need in our community and their family members. The beginning fund balance for the Veterans Assistance Fund, you can see $787,000 approximately, and anticipated to come in through property taxes. This fund is funded by property taxes, is about $472,000 in 2021 that we anticipate. There's only one FTE that works within this program to help to administer this fund, and the proposed expenditures include that FTE, as well as direct assistance to veterans and their families of $366,000, which leaves the Veterans Assistance Fund with a healthy ending fund balance projected of $890,000. The Veterans Advisory Board, which you appoint, will be coming forward soon and making recommendations to ways in which they may propose providing even more funding to veterans in need in our community, especially in light of the COVID-19 pandemic and the disparate impact on veterans and their families. Our goal is to provide as much assistance as possible to veterans in need, and so we're working on some plans to provide outreach and provide more services and advertising and promotion of our veterans assistance programs. Since many of those programs are delivered out of the Lacey Veterans Hub, the COVID-19 pandemic has had an impact, and we want to make sure all veterans have access to this fund. Any questions there?
No, just a comment, this is Romero. We have received some public feedback related to this fund in the past, and I appreciate the perspective. They were looking as to ways as to how we can increase the assistance to veterans here in the county, because looking at the 10-year financial plan, I'm sure you're going to get to that point, at some point. It is a concern to me that over the years we'll continue to increase the ending fund balance of this fund, which I believe that is not really the intent, to accumulate an ending fund balance. So just a comment.
Thank you, Ramiro. You're correct. And we we and the Veterans Assistance Advisory Board absolutely share that perspective that we want these funds to be in the hands of the veterans that need them. It's an application-based program, and there are some statutory requirements that can sometimes limit the amount of people that can be eligible for this program. But there are some ways in which the Board of County Commissioners can make decisions about some of those eligibility requirements to help increase access to this fund. And so that's what our goal is to do, is to be able, we don't want to see a big fund balance in this program that's fully intended to directly support veterans.
Can I ask a question there? This might be for Ramiro, but Ramiro, the input that we've gotten from letters is not about that we're not spending the money, right? There's some other.
There's some other underlying, eligibility, which we addressed that, but also as part of the comments that recall was where the Veterans Fund is going. So, and I have talked to the internal auditor just to make sure, and we're going to be adding this next year's workload to the internal auditor just to make sure that we have a good understanding how the Veterans Fund is managed.
So I would add that it wasn't that many years ago that this fund was having trouble maintaining a fund balance. And there were a few steps taken at that time to curtail spending. But perhaps what we're seeing is that was effective, and it's time to take a fresh look at how we're allocating this money.
Yes, agreed.
I have a quick question, maybe for Robin. Shelley said that this was property tax funded. Is there something besides property tax that assists us in this fund?
Not that I'm aware, but we have the financial plan. So when Shelley's, after she talks to you about the challenges of the department and the policy level requests, we will be reviewing the financial plan. So we'll get more in depth in this later in the morning.
Okay, thank you.
Mark, did you have something to add, Mark?
I just wanted to say that on October 19th, we have the Veterans Advisory Board meeting, and this is one of the topics. This is actually the primary topic we're going to be discussing on how we can get more money to the veterans and increase our programs. So it's definitely on the forefront, and the commissioners, you guys are more than welcome to show up. I can send you the link. It's on October 19th at 6 p.m.
Okay. Good. Thank you, sir.
You bet.
Go ahead, Shelley.
Thank you, Mark. Okay, I'm going to move on to Fund 1400, which is our affordable housing fund. It also includes homeless response, as I shared earlier. And the manager of our housing fund, Tom Webster, is on the line if you have any questions that I can't answer about this. But you're also going to see some significant revenue fluctuations here in Fund 1400 due to the COVID-19 response, as well as the priority that you have placed on housing and additional funding that we have received to address the public health crisis of homelessness in our community. So in 2021, the estimated beginning fund balance is about $3.9 million. I should mention that in all of our funds, we maintain a 3-month operating reserve, as well as any other requirements that there may be based upon that fund. For housing, we also have to maintain an additional approximately $500,000 due to our CDBG grant, which we must maintain that because some of the affordable housing projects that we fund may take up to 5 years before they are seeking reimbursement for those capital development costs. So that's why we maintain a good, healthy fund balance in our housing program. Revenues in 2021 are estimated to be about $13 million. We do have some new sources of revenue this year. One of those is SHB 1406. So that is a new funding source for our county to be able to spend on affordable housing development costs. We'll be talking a little bit more in detail about that as we go through, as Robin mentioned, the detailed 10-year financial plan, so you can see exactly what that'll look like. We also have additional revenue due to COVID-19 in our Community Development Block Grant Program, which is a federal HUD program that allocates funding. The priorities for use of that funding is COVID-related costs, such as testing, food, and sheltering for those that have been displaced or in need of housing due to COVID-19. So that's why you'll see some more revenue, and we also this program is also funded by local document recording fees. And so while we're looking at the kind of revenue increase as people do things like build new homes or refinance their new homes, a portion of those fees go to actually directly support affordable housing and our homeless response efforts here locally. So that market can really impact our revenue stream in housing. There's also many state and federal grants that also go into funding this program. So expenditures are proposed in 2021 of nearly $13 million in a mix of affordable housing and homeless response activities. We contract with many local nonprofit organizations and affordable housing developers to help to address our lack of affordable housing here and the increasing numbers of people experiencing homelessness here in Thurston County. Our estimated fund balance in 2021 is about $4.4 million that we anticipate having by year end. Any questions about this fund?
I'll get it. No, go ahead, Shelley.
Okay. All right. I'm just gonna move right along here for the sake of time then. Sorry, I don't know how to mute my phone. My apologies to whoever just called me and got their call declined. Okay, so we're now to Fund 1500. Okay, I apologize for the distraction there. So 1500 is one of our largest funds, actually our largest fund that we have. And again, just as a refresher, this fund 1500 includes the majority of our public health activities, including our community wellness programs, our vital services programs, as well as our disease control and prevention programs. So our estimated fund balance in 2021, as you can see here, is $8.6 million. We have revenues anticipated at nearly $15 million. And I will add again that that this is where many of our grants and contracts come into Fund 1500. So I mentioned approximately 80% are grants and contracts that go into supporting this fund. You have heard recently and in approving our consolidated contract through the Washington State Department of Health. That is our instrument where our federal and state funding passes through the state through that contract, and that's reflected in this anticipated revenue. This is also where we have two of our most flexible unrestricted funding sources, and that's our Public Health Assistance Fund, which we receive an allocation of approximately $1 million from the state of Washington that the legislature appropriates to us each year. And this is also where your general fund investment largely includes, and that's has typically been about $1 million each year in general fund, with, I should say, the caveat, some of that does go to environmental health. This also, yes, sir.
Oh, sorry, maybe you were about to answer, but the fund balance here looks like 7 months worth versus 3 months. What is there a reason why this is a high fund balance of 8 million?
I'm going to ask Marcia to take a stab at answering that question.
Good morning. This is Marcia Boyle. So that represents just the mathematics of going from the 2021 estimated beginning fund balance, the proposed revenues, less the proposed expenditures, and the resulting fund balance. So it doesn't necessarily represent a 3-month operating. It's just the mathematics of the current proposed. So we would just need to be concerned about looking at any decisions that would drop us below a 3-month operating. Does that make sense?
No.
Not really to me.
Not
Why?
really.
But 8.3 million is a large fund balance if your annual revenues and expenditures are around 15. Just based on the structure of the other funds, and Shelley said you try to keep about 3-month operating reserve in each fund.
Correct. So we are well over the reserve that's needed for the fund. So it's just a reflection of what's currently residing in the fund balance. So if we had a really bad year, we could potentially keep staff on a little bit longer to get new revenue streams to maintain those staff and those services that we provide. I'm not sure I'm making full sense, but the proposed budget indicates that we would be spending more than we bring in, which is the difference between the 8.64 and the 8.3.
Yeah, I'm not asking about that. I'm just asking about like 8.6 or 8.3. Why is it that level? I mean, we'd love your description is true of any fund. Like you'd love to have a nice padded buffer to deal with any contingencies, but you don't usually have that luxury. I'm just wondering why this one has that luxury to have that kind of continuing year-to-year, buffer. When we're bringing $1 million from the general fund in there, as you said, as Shelley said.
We'll take a deeper look at that at the break, and then when we get into our 10-year financial plan, that might paint a little bit more clearer picture, and we'll try to get a more accurate view of what that fund balance is reflective of. I will also say one thing that Marcia didn't mention is we receive a working cash advance from the Department of Social and Health Services for one of our programs, and that's developmental disabilities, and that's also approximately $1 million of that fund balance that we're required to maintain in addition to the 3 months operating reserve. We also, as Marcia stated, do like to have a little bit more of a buffer in this program because of the volatility of the grants and contract funding that is the primary funding source for this particular program. And most of those funds are, again, they are restricted in terms of what type of program or service they can be used to support. And so the entirety of our funding balance does not necessarily reflect a surplus of less restrictive funding sources, such as general fund. So, but we'll definitely go into more detail to make sure we answer your questions about that.
Thanks.
And managing expectations. When you're through with the funds page, the funding page, then we'll take a break and then get into the challenges and policy level proposals. Okay.
Okay, that sounds great, sir.
All right. Thank you.
Okay, so I'm going to jump ahead here to Fund 4520, which is our Environmental Health Fund. This is a fund that was just established the last biennial budget. Previously, it had been combined with Public Health and Social Services Special Revenue Fund 1500, and due to the size and differing nature with this fund being largely fee-based revenue, we established its own separate fund for it. So when we go into the funding 10-year financial plan, you'll also see that we don't have as much history of this fund. So we've only had it established for just a couple of years, although environmental health has been one of our foundational public health services for many, many years. So again, largely fee-based program, as well as some additional grant and contract funding, primarily through the state and federal government. Estimated beginning balance here in this fund is $2.7 million. We anticipate revenue of $5.7 million. Again, we took probably a more cautious approach to this based upon the bleak economic forecast that we were seeing back in June and July when we began to build this budget. Since then, we're really happy and much more optimistic about the outlook of the revenue, as we've seen the highest record number of permits and applications in July than we have seen in history. You heard that reflected in Director Cummings' presentation in Community Planning and Economic Development. And because many of our fees are tied to land use, then we essentially expect that revenue will be a little bit better in that area. However, I will say that I mentioned our food, schools, and our food, schools, and pools program, our food and environmental services program. That is also a fee permit-based program, and as you can imagine, COVID-19 has really changed the outlook of that, with schools closed and unfortunately, many food establishments having to temporarily suspend or change their operations. That has had a modest reduction in some fees in that area. But we've also seen some increased demand for our work in that area because of COVID-19 as well. So a little bit of uncertainty going forward, but this is our best guess projections here. So we have expenditures proposed at $15 million. I'll go into more detail as we go through our policy level requests, as well as our 10-year financial plan. But with expenditures that exceeding revenues, I want to just call your attention to that we do anticipate a couple of one-time or hopefully one-time costs that are reflected of this number, and that includes our portion of the replacement of the aging Amanda system, which you see reflected in your information technology budget as a proposed expenditure halfway through 2021 for the next 1 to 2 years. We Our users in environmental health and both our food program and our on-site program represent about 36% of the cost of that Amanda replacement program. So we plan to spend revenue on that, as well as a fee study, which I'll go into more detail about, to help this, my apologies, to help environmental health achieve sustainability as we go forward in years and we see rising costs not keeping up with our current fees. And so that leaves us with an estimated ending balance of about not eight, I was looking at the wrong line, about $1.4 million. Any questions on environmental health? Again, Art Starry is on the line if you have any questions. I
have a question.
Yeah.
I'm sure you're going to touch base on when you get to the 10-year financial plan and the increase in expenditure. You sort of alluded to the fact a couple one-time expenditures. But the financial plan paints a different story a little bit in terms of the continued higher in expenditures where the ending fund balance is not adequate.
Yes. Yes, we will go into more detail, and you will also see that our top priorities and policy level requests are environmental health expenditures, and I'll explain that in more detail. But you are right that the longer term forecast that we have for our environmental health fund is not sufficient to meet the demands of our community and customers as we anticipate it to be in the coming years. So I will explain a little bit more about that as well going forward, and also how that relates to the environmental health challenges that we are facing. Okay, I know everybody needs a break, so we have just one more fund here. This should be an easy one. Our Information Technology Replacement Fund, Fund 1490. So our department has our own fund to replace our hardware and software equipment. We have paused expenditures on this fund as we have purchased all of the equipment that we need that is on a 5-year replacement plan. So we intend to contribute $1,000 in revenues, and this comes from other funds and programs within our department, and have $30,000 in expenditures needed, largely for computer-related equipment purchases. So that fund balance there is about $50,000 anticipated at the end of the year, which we feel is sufficient to meet our needs for equipment at this time. And there is one more fund. We have a debt service fund, which isn't included as part of this presentation, but I just did want to mention it to you because you may have that information in your packet. That's Fund 4510, our Community Renewal Septic Loan Program. So this was a program that was offered for many years, and it sunsetted in 2016. But many of those loans to customers that needed assistance in repairing or installing new septic tanks, that loan program goes for up to 20 years. So while we're not adding any new debt to that program, we do continue to maintain that fund until the last loan has been paid off. Any questions about?
Yeah, so how much money is in the fund?
That fund has about, by memory, about $340,000 left in it.
And what's the expenditure each year on that fund?
Marcia, can you answer the question about that particular debt fund?
Good morning. I don't have that information in front of me. I know that it's a shared responsibility between us and the treasurer's office. So Ann Lundeen is making payments to the State Department of Ecology for the principal payments. And then the interest payments end up showing in our books. I would gather to say, at least on our side, it's at least $10,000 per year in interest payments. I'm not certain because it ends up showing up in the treasurer's books for the payments on the other side. But there are caveats on how we can spend any remaining fund balance on that account.
And what about annual revenue?
So there's no new revenue other than the interest earning that we earn on the fund, and then the payments made by the people who have the loans. And so that pretty much comes in as revenue and then is paid back out to the State Department of Ecology, because the loans that were issued were anywhere from like 0 to a max of 3% interest. So they were intended to be little to no interest for the homeowners so that we could improve the environmental health of the land that the septic is sitting on.
Is that fund recently been taken over by the state and we don't administer those loans anymore?
Correct. So the state worked with a private finance organization, and so county residents can still apply. They just need to apply through the state.
Okay, thank you.
You're welcome.
Go ahead, Shelley.
Did you want me to take a pause here for the break before I go into challenges?
Yeah, let's take a break. I have 10:15. Is 10 minutes enough time for you, Marcia, whatever you're going to get some information at the break?
I am going to apologize, commissioners. I am actually on vacation and out of the country. And so I was going to chat with Corinne to see if she could pick up any of that, or if there's a way that we can get it when I am back in the office on Monday.
That's fine with me. What time is it where you are?
I am an hour ahead of you.
Wow. Okay. Enjoy your vacation. We'll take a 10-minute break. We'll be back. Let's say at 12:30. We'll be back at 10:30. We'll be back.
Thank you.
Thank
We're in
you.
recess. Thank you. Back is still October 14th, 2020. We're continuing on with the Public Health and Social Services budget. Now we're getting into challenges, and then we'll get into budget proposals. Go ahead.
Thank you so much, Commissioner Hutchings. So our department is facing many challenges, probably more challenges than we have ever faced in the history of Thurston County and in our community. This pandemic is unlike anything that we have ever experienced in our lifetimes, certainly not here in the last 100 years. That has had a significant impact on our operations, on our funding, and on our future. As I stated, we have been in pandemic response for over 250 days. Our incident management team activated on February 6th to respond to threats of the new novel coronavirus, COVID-19. Since then, in what is a relatively short amount of time, we are at over 1,400 cases of COVID-19 and 20 deaths here in Thurston County. Our COOP was activated, our continuity of operations plan. Our department is always preparing for any type of emergency, and staff know that when they take a job at Public Health and Social Services, they may be asked to serve in an emergency in a different kind of role. And that's exactly what happened over these last 7 months. We've had over 50 of our employees, so more than or approximately half of our employees have been deployed to work on the incident management team or COVID response in some way. So a significant amount of our work and efforts over the last year have been entirely focused on COVID-19 control and response. We expect that this is going to continue for quite some time into 2021. While we are very hopeful for a vaccine in our future, we don't expect that it will be widely available for our community for much of 2021. So we're in this for a while, and we're also preparing for a challenging fall and winter ahead as we continue to see our cases rise and community transmission go up. The responsibility of our department during this pandemic for our entire community and as part of our state response is tremendous. We, as you know, are responsible for not only controlling the spread of COVID-19 through a variety of different ways, but we also have to support our healthcare system in ensuring that they have the capacity to be able to meet the healthcare needs of our community. That's part of our role in public health, to make sure that healthcare is accessible for all residents of Thurston County. We have stood up a new 24/7 isolation and quarantine facility that's completely new to our department. We are engaged in direct healthcare, providing direct healthcare services, in offering testing in congregate care facilities whenever we deploy our strike team, and also throughout our community. We've had to greatly increase our workforce to be able to investigate cases and do contact tracing to to control the spread of this disease. The state has given us some requirements that we must meet, including the number of staff that we must have per our population size in Thurston County in order to adequately respond. So that has been very challenging to us. We've been very fortunate, and we're so grateful that Thurston County and you as Board of County Commissioners, you made public health a priority in this response from the beginning. You have been so incredibly supportive. You have allocated the resources that we've needed to to stay on top of COVID-19 in our community in a way that some of our Puget Sound neighbors to the north have not been able to. And I'm so proud of our response. But again, we are very challenged in that we had to very quickly scale up our efforts and our staffing to be able to handle this pandemic in our community. That has impacted our funding. It will continue to impact our funding. We kind of have a current kind of feast or famine problem, as I've called it, which is very fortunate to have the significant investment of CARES Act funding that you have allocated to our department, as well as what the Washington State Department of Health has passed on to support not only public health, but also our community needs, which also connect to our mission in public health and social services. And so we have a lot of funding right now, but the future is very uncertain. So we know that as of January 1st, that we're going to continue to need isolation and quarantine facilities for those that have no place to go. We know that we're going to continue to need to have drive-through testing and community-based testing sites so people can quickly get tested. We know that we're going to continue to have cases that need to be investigated and that people are going to continue to need supportive services to help them stay isolated or quarantined. Until Congress reconvenes and our state legislature finds a safe way to convene, we don't know what our funding outlook will be. One thing that we have been told is that we are proposed to receive funding for 24 additional FTEs to support our disease investigation and response in 2021. But again, we haven't seen that funding yet, and so we don't know exactly what that will look like. And so that assumption was not built into our budget proposal for that many additional FTEs. But as we go through the policy request, I'll tell you what we have assumed. So the COVID-19 pandemic really relates to a challenge that we have faced for many years, and that's increased disease burden in our community. As Thurston County population grows and grows at the rapid rate that it has, and we live in a world today which we've seen reflected in the spread of COVID-19 across the globe, is that people travel all over. We still are threatened by novel viruses and new diseases that we have not ever experienced before in our lifetimes or in our state, in our county, and in our world. So we have seen resurgence of things like measles. We still deal with threats of tuberculosis. We are continuously faced with new and challenging health conditions and diseases that really threaten us, and we have to be prepared for that. That also ties to the next challenge of a critically underfunded public health system. So you've heard me talk about this for many years. Being a part of our governmental public health system, this pandemic has also really highlighted exactly what we have feared for so long. We knew we could be vulnerable to a disease like this, but year after year, and this is not a reflection of Thurston County's and the Board of County Commissioners' investment in public health, but overall as a public health system worldwide and throughout our government, public health funding has typically been cut year after year, or it has remained stagnant. And that has really threatened our ability to deliver what we call foundational public health services. We are really fortunate that the Washington State Legislature recognized the importance of those foundational public health services that local public health jurisdictions must provide to protect the health of the community. It's what our citizens expect of us. It's what we must deliver every day. So that includes things like making sure that the food we eat is safe and the air that we breathe is clean, and that the water that we drink is safe, and that we have programs in place to ensure that vaccinations are available, and that we are preventing the spread of disease in our community, and that children are protected and have what they need to be safe and healthy and to live long lives. So those foundational public health services could not be more critical than ever. We were fortunate to receive a modest amount of the request needed for foundational public health, which in the state of Washington was estimated to be over $400 million. So we have a real significant gap. We've been trying to work our way through that year after year, and continue to be challenged with that. The demands of our community have gone up. The needs in our community are greater than they ever have been. The public has an expectation of what our Public Health and Social Services Department will provide. And that's what we're here to do, and we love to do it. But it's really challenging to do when, again, like I mentioned, for some of these most critical programs, when 80% of those funds are often provided by short-term grants that can come and go year after year. I mentioned our community health rankings, and Thurston County, I've lived here my entire life. I raised my children here, is a wonderful, healthy and safe place to live, work, and play. And Thurston County ranks among the healthiest counties in Washington state. And I'm really proud of our department's contribution to that. That being said, we face a lot of challenges in terms of our community health needs. And we see that reflected in our county health rankings. This year in 2020, we declined to be number 9 in the healthiest counties in the state of Washington, which is still good, but we don't want to go in the wrong direction. A way in which we can help to improve the health and well-being of our Thurston County residents is by continuing to make investments in our community health programs that support improved social determinants of health, because we know that that's where we get the greatest investment. We also get a great return on investment whenever we're doing any programs that benefit children and youth. So some of the increased community health needs and demands that we've seen reflected in the data that we monitor and look at include things like obesity. We've seen adult obesity continue to rise. We have seen, despite the great efforts and strides that we have made to combat the threats of tobacco, there's still people that smoke too much in Thurston County, and we're seeing that play out later in life in terms of mortality rates and cancer rates and things like that. We made a lot of great strides in the previous decade on preventable diseases such as sexually transmitted diseases, and we're seeing that spike up again. We're seeing things like homelessness and behavioral health needs greatly increase, and that threatens the health of our community long term. We've seen increase in suicides and accidents that are completely preventable, and our department has a key role in helping our community to address some of these challenges. So the data really helps to guide us on where we have room to improve, and really supports how important it is that we continue to make investments in a lot of the programs and services that you have helped us to support. I touched on our homeless crisis and opioid epidemic. 5 years ago, things looked very different here in Thurston County. In 2018, you, as Board of Health, declared homelessness as a public health emergency, and also followed that later in the year by declaring an opioid epidemic here in Thurston County, as we've seen more and more people struggle with opioid use disorders, and we've seen increases in overdose deaths, which again are completely preventable here in Thurston County. The homelessness crisis, we are doing a lot, and you heard about that yesterday, a lot of great things to help to move forward and create more housing opportunities and strengthen our homeless response system. But we are quickly outpaced with the number of people in great need in our community. So you will see that reflected in our budget for housing, that we continue to seek new opportunities and we need every penny of revenue that we have to address this great challenge. Another threat that we have faced involves racism. So we have long held in our department equity as a core value. In fact, our very mission of working together to achieve the highest level of health and well-being for everyone is the definition of equity. And in our department strategic plan, you can see that health equity is a strong theme in all of the work that we plan the work we've done in the last year and the work that we plan in the following 4 years, as we identify growing disparities in our community among different groups of people that should not exist. We are planning to help to support a racial equity plan for both to address racial disparities and other types of disparities that we see among different groups of people in our population, both internally to our department, internally to Thurston County, as well as externally to the entire community. When we have these kind of disparities that exist in our community, where you have people that live in one zip code of Thurston County living significantly less years of quality life than someone else in a different area, and the only difference may be their race, maybe their gender, maybe their socioeconomic status, we have a responsibility to ensure that we are doing something to help to not only identify that, but to take action. Environmental health is one of your priorities, as well as our top priorities. We are faced with threats from climate change and how that is impacting our environment here. We are taking action on that with the Climate Action Work Group and mitigation planning engagement efforts. But there are also a lot of other threats to our environment, especially when it comes to our water quality. We have, as you know, and I know because you care so much about our environment, we've seen declining water quality in many areas. Thurston County has many septic systems that can help to contribute contribute to some of our declining water quality, and those are all things that we need to address. We also have to continue to proactively respond to solid and hazardous waste threats to our environment, and continue to ensure that we are doing everything that we can to protect this beautiful environment that we all live in Thurston County, and make sure that our children and grandchildren ahead of us will have a better air, water, land than what we have been fortunate to have. So you see that reflected as a top priority in the upcoming requests that we have. Our workforce development is also a challenge because we have done an amazing job in Thurston County at retaining an incredible team of workers here for many, many years. But we have many planned retirements in the upcoming years. And so that means we really need to make sure that we have good succession planning in place, as well as that we're retaining the great workforce that we have and being able to recruit a new workforce to our department. Given the critically underfunded health system that we're in, we ask more and more of our workers. We ask them to do more and more with less resources year after year, and that gets very, very challenging. We also have to ensure that we are modernizing. Again, this COVID-19 pandemic has really highlighted some of the areas in which there are a lot of opportunities for improvement in terms of technology, like all of us being able to be here on this Zoom and some from faraway places is really a step in the right direction and being more efficient with the resources that we have and utilizing technology in a better way that also protects the information and privacy of the people that we are serving as well. So we have a lot of room to improve in that area, but we're taking some really strong steps forward to meet that challenge. Yes, sir. So
that's been about 25 minutes almost. We have a lot to cover. We're gonna have to step it up, okay?
Okay, no problem. And that is actually the perfectest tie-in to the challenge of fiscal sustainability. So, and so I'm just gonna jump right ahead here into our policy level proposals. Okay. So one thing that I want to share before we jump into this is we do have a lot of policy level proposals before you. In part, we are a large and complex department, and we have a lot of challenges, as you just heard me go on about. And we also have a lot of community needs community needs to respond to. So I'm gonna go through this. For those that apply to treatment sales tax, I'll briefly highlight those, but we'll skip over some of those because we know that they'll be discussed in more depth on Friday, and I want to make sure we have enough time. So our first policy level priority, B4012, you should have that before you, is to request an environmental health program manager. This is a full-time position that we are requesting to help support the tremendous growth that we've had in this division and the additional grant responsibilities that we have. We have only 2 managers in our entire division of over 30 employees and many different programs in our environmental health division. Specifically in our water quality division, there's really a need to provide further management support to this particular group so that we can ensure that we are providing the support that staff in these programs need, and that we're providing the proper oversight and the and able to deliver on the various grants that we are responsible for. I want to pause and give an opportunity for Environmental Health Director Art Starry to chime in here to provide any further context to this policy request.
Good morning. This is Art over at the Environmental Health Division Director. And as Shelley indicated, one of the challenges that we have in our water quality program, and it's actually water quality and septic system monitoring and maintenance, is that we do have a variety of grants and projects that are coming in. We have a span of control issue where the supervisor of that program now has 10 staff, and additional staff are needed. And that's another policy position that's coming up. So we have again, both trying to track these projects and the kind of diversity of knowledge that's necessary to do a really good job of managing these things. We have, technical regulatory issues as well as scientific water quality investigation issues or needs and expertise that's needed to oversee these. And so one way we envision doing this would be if we had a program manager who had a higher level of expertise in one area or the other, we could deal with, help address the span of control as well as help manage the grants. We probably have somewhere in the neighborhood of, several $1 million worth of grants related to Puget Sound water quality issues that are either on the books or pending. And again, we don't want to lose those opportunities. Right now we're kind of we're not keeping up at our spending rates on that because of staffing and supervisory control. So that's something we think is a real priority, and I appreciate that Shelley has put this made this a priority for our department.
Great, thank you, Art.
Thank you.
Shelley, real quick, the first couple pages are treatment, or the first page is all treatment sales tax. Is that for Friday? We're not covering that today?
That's right, sir.
Okay. Ty, you had a question. Go ahead.
Well, Shelley, you've got a complex set of funds and revenue sources. So I just want to ask you for each policy request that you tick through, be really clear about how it's funded, where the money's coming from.
Okay.
And you went through all the funds, so I have a good sense now of those, but I think we're all going to need to know that as you go.
Okay, great. Thank you,
Hang on, though. Gary, did you have a question?
No, what Commissioner Menser said applies with me as well.
Okay, Robin, did you have your hand up? Okay, go ahead, Shelley.
Okay. So this priority one policy request is for Fund 4520 in environmental health. And funding would be provided by fees, rates and charges, as well as contracts and grants. And we have an additional $300 in grant revenue that we expect to receive in the next 2 years. It'll be really critical that we have the proper management and staffing levels to do this, as well as to address some of those workforce challenges ahead of us as we improve and become more efficient in how we're able to do this work and deliver on the grant requirements in environmental health. The next priority is priority 2. This is for Fund 1500 in our disease control and prevention program. This is related to COVID-19 response. At the time that we prepared this budget request, we had received word that we would be receiving funding for 2 disease investigators, which are classified as epidemiologist 1 in this request, to provide COVID-19 disease investigation support through funding from the Federal Health and Human Services and Center for Disease Control passed through the state of Washington. This is a placeholder here for us because, as I mentioned to you, we believe now that we're going to be required to have 24 FTEs, and this only includes 2 that we knew about at the time that we prepared this budget. So you would likely see, if we do receive that revenue, an amendment in the future. And we may have more information as we get to year end here. But that is what that position is for.
Shelley, are you saying we're going to get revenue for 24 additional fund positions?
Yes, I believe that is what is in the Department of Health's request to the legislature.
For our county, 24 FTEs?
Yes, sir.
Okay.
That's the level that has been determined for a county of our size. They do that based upon an allocation by population.
Okay.
Again, we'll have to see what that looks like in the future, but we know we're going to need at least 2, probably a lot more. So.
And where would that 300,000 come from? Is that also speculation?
No, at this point, we have now received that funding in the consolidated contract that you recently approved.
Oh, okay, great. So we've got that in. Good enough. Thank you.
So yes, this revenue and expense are the same. These positions would be fully funded. Priority 3 is also in Fund 4520, our environmental health program, the Food and Environmental Services program for a temporary food inspector. This is a planned to be a 1-year only position. It is a 1.0 FTE, and that's because one of our longtime wonderful food inspectors, Don Moulton, he retired back in June, I believe. Technically still on the books because he was a 30-year employee of public health. And so while he has gone off into retirement, we still have a need to essentially overfill for this position in the next year so we can keep up with the demands of inspecting our food establishments. And that's going to be really important. Even though I mentioned that the work is kind of fluctuating due to COVID-19, there are greater demands of our food inspectors because they have additional compliance now and education to do about COVID-19. And it's going to be more important than ever that we are controlling and preventing any foodborne illness outbreaks because we simply cannot afford to handle any other disease outbreak at this time. And this will allow 300 more establishments to be inspected in the next year, if granted.
I do have a question on that. Hutch, do we have time for this?
Go ahead, go.
Are we going to have restaurants that go out of business, is one question, and then you've been identifying the fund it's associated with, but I don't think I heard that with this one.
Fund 4520, our environmental health fund.
Okay. And are you considering businesses that are going out?
Yes, we are. We've heard some projections of kind of what the food establishment industry might look like on the other side of COVID-19 with some concerning estimates of up to 30% of businesses that may not be able to continue. Right now, we don't, we haven't quite seen that yet. Just a lot of changes in service delivery. And I also might add that this is a revenue generating program because we charge fees for these food inspections. And so this is permit revenue.
So this is revenue neutral then?
This one time will be dipping into that fund balance because we are still paying for the staff person that has entered retirement until March of 2021.
Okay.
But yes, if we don't do those inspections, we won't bring in revenue.
This is Art, and I should also add that one of our other food inspectors has been involved with the COVID response pretty much since day one, full time. We've had other folks doing it, so we're a little bit behind on keeping up with things. So we really do need additional assistance.
Okay, press on.
Thank you. So moving forward, I mentioned this earlier on in the presentation about the need to do a fee study. So RCW 70.05 states that our environmental health fees shall not exceed the cost of programs and services. But what we are seeing, along with our partners in public works and community planning and economic development, is we're beginning to see that our current fee schedule is not sufficient to cover the increased costs that we have of delivering the services that people need in these programs. So we are joining together with those two other departments to engage a consultant to help us to assess our current fees to see if they're sufficient or if the board may need to consider increasing them to meet future demands.
Are the other two departments, CPED and Public Works, putting in $100,000 as well? Is it $300,000 study?
I believe so. I think that was an equitable split between the departments.
Okay, thank you.
And the fund again?
I apologize, sir. That would be Fund 4520, also environmental.
Okay. Thank you.
Almost through our environmental health requests. So priority 5 is to add an environmental health staff person to support the increased demands in these programs specific to our records requests, policy updates, web support. This ties to the challenge that we have of modernization. So we have hundreds of public records requests in our environmental health program. We have archived and paper records that we have to go through to be able to respond to these in a timely and legally required manner. There's a lot of risk in this area. The public continues to need up-to-date current information, and we have many policies within our sanitary code and others that need to be updated and transferred over to electronic means. This is an area in which will give great efficiencies to this program and help us to move forward and have sufficient capacity for there. So this particular funding request also is partially funded by new grants that we have coming in environmental health and 4520, as well as fees. So all existing revenue that we have.
And without this, it puts us in legal jeopardy, as the last sentence says.
Yes.
Okay.
Okay. So priority 6, this is tied to a treatment sales tax request. So I'm gonna skip over this one in the interest of time, because you will be hearing more from the Treatment Sales Tax Advisory Board about that program. Again, priority 7 is a justice outreach program related to treatment sales tax. So we'll discuss that further on Friday. Priority 8, I do want to draw your attention to, and that is, as you know, we have received a contract offer from the Healthcare Authority to Thurston County to implement a 1-year law enforcement assisted diversion program. Thurston County Public Health and Social Services would serve as the fiscal agent for this program, which will address many of the county's strategic priorities related to law and justice, equity, and behavioral health. It also supports the COVID-19 response because it keeps people out of our local jail and instead gives them the services that they need. This does connect to a TST presentation on Friday because there's $300,000 of that is required for match. So you'll hear recommendations further on Friday. But at this point, we do have $1 million that has been offered by the Healthcare Authority should you approve this program moving forward. and it would be no positions. It's all subcontracted positions. Okay, moving forward. Priority 9, increase a drinking water laboratory position. Currently, this position is funded at a 0.9, and the person in that position is retiring. And so what we hope to do is be able to increase that to a full-time position. The business need is for a full-time position. Again, our water lab does generate revenue and provides a great service to our community, and we believe we'll be able to meet that challenge of attracting and retaining a strong workforce if we're able to post this position at a full-time. That gap is estimated to be about $12,000, and we believe we have sufficient revenue to support that.
And the fund?
And that is Fund 4520, Environmental Health.
Good.
Just one minor little thing. This is in the drinking water program. It's actually one of the folks who does sanitary surveys and other work. He's supervised by our drinking water lab supervisor, but it's a little bit different. It's a different person. Just for the record.
Okay.
Thank you, Art. Priority 10 is a treatment sales tax proposal, so we'll address that on Friday. Priority 11 and 12 both relate to Fund 1400, our housing fund, excuse me. So we have received additional community development block grant funds specific to addressing the COVID-19 crisis that I covered earlier in the presentation. There is $459,000 that we expect to receive and be able to distribute out to the community to support support the COVID-19 response as it relates to priority areas that the board and the Regional Housing Council have weighed in on, which include things like testing, food security for seniors living in rural areas, as well as sheltering and isolation and quarantine. So we know that we are receiving these funds, and so that's what this request is about, anticipating that increased revenue. No additional staffing will be required to implement that. Priority 12 also is Fund 1400 housing, and this relates to that Senate House Bill 1406. That is a new tax that is available to Thurston County, as well as to our cities, to support new affordable housing in our community. Thus far, we expect that revenue to be about $333,000. There will be some funding that is needed to support our existing administration of that fund, as well as to engage consultants to do any environmental review studies that are required to develop that new affordable housing.
That, Shelley, that's not actually a new tax, isn't it? Isn't that just a retention of money that would normally have been sent in?
Yes, sir. You are absolutely right. There is no new tax to any of our Thurston County citizens.
Thank you.
But state funding that is now eligible to Thurston County to be able to utilize. And yes, Robin.
I'm curious why you're only asking to spend $30,000 of an estimated $333,000 in revenue.
My apologies. The rest of that is planned to be allocated to an affordable housing project, of which has not yet been identified.
So you'll need authority to spend all of it.
Yes, we will. Although that may not be. We hope that it will be in 2021, but we don't know yet as to
maybe in a future year.
Yes.
Okay.
And isn't this one that we're partnering with the other jurisdictions?
Yes, we are. The Regional Housing Council and the others that have 1406 are collaborating together to invest this new resource in affordable housing projects that'll make a long-term difference in our community.
Okay, thank you.
Treatment sales tax is the next couple items, and so I'm going to just skip through 13 and 14. Priority 15, we have a request to extend end-dated staff positions. This affects 3 FTEs, and this is in the Nurse Family Partnership Program. The funding that we receive through the Department of Children, Youth, and Families runs on the state fiscal year. And you may recall that last year you allowed these positions to be extended through the end of the calendar year. We fully expect that after June 30th of this year that DCYF intends to extend this grant and these positions. And this is our request because the position is slated to end at the end of this year, and we will continue to have 6 months of funding for this, and we expect to have a full year of funding for it.
Shelley, which one is this? Are we on?
This is priority 15. This
15.
is for Fund 1500, our Nurse Family Partnership Program, extending end-dated positions, and we have the revenue to. We believe we will have the revenue to support it.
Thank you.
And these next couple things should be very easy. Priority 16, we have a correction to make that had to be a policy level request between Public Health Fund 1500 and Environmental Health Fund 4520. This was related to that when we established the new 4520 fund last biennium, we still had another staff cost associated that was in the incorrect fund. So this is just correcting that and cleaning that up to make it accurate.
That's more of a technical
fix. Mm-hmm. And then priority 17 also, what we are working on in our department is allocating our internal administrative costs to be equitably distributed and applied across to all funds. So there's no net change in expenditure or revenue. Just trying to, again, be fiscally responsible and fair and equitable in our allocations.
Well, I show 4006 as a TST.
Yeah, I think there's a numbering issue there.
Yeah, that is a numbering issue.
What is 17?
That should be. Marsha, can you chime in real fast on that one? You might be quicker than me.
Unfortunately, I don't have those documents in front of me. There is a chance that the numbering's wrong, but the net impact is a redistribution of administrative costs to the other funds. So you might see some increases in other funds and a decrease in Fund 1500.
Yes, Fund 1500. Thank you. I just found my notes.
4020 maybe.
Is it 20? Must be 20. 16 and 17 show 40-20. They're both Public Health 1500 and 4520 are the funds.
Those will be the primary funds that are impacted.
Okay. Is that the one we're looking at then? Indirect allocations rather?
Yes, that should be the indirect allocation.
Priority 17.
It looks like it's, the B 4020, all 3 items.
Okay.
Thank you. My apologies for the confusion on that one. And that concludes our presentation. I know that you have some questions about some of our 10-year financial plans. So I'll pause here for any questions that you have about everything I've presented thus far, and then we can jump into your questions about financial plans.
Okay, do you have, I'm turning to the commissioners, any questions thus far on the policy level requests?
Not so much on that, but when are we going to go over the 10-year plan? Is that planned in the next 10 minutes?
Yeah.
And then that's it?
So we did reserve time on Friday in case we need to roll anything into that. I don't know what your schedules are after 11:30 this morning, if you're able to run a little long today. But if, we do need more time to go over these financial plans, we can use some of that time on Friday that we reserved.
Or
Well, at noon,
if you like, I can cancel the directors meeting at noon. And since that time is already reserved with your calendars, we can probably use that time to go through the financial plans.
let's do that, if that's all right with my seatmates.
Yeah, that's okay with me.
Ty?
Are folks busy from 11:30 to 12?
I'm not.
I'd rather just do it now until noon and then have our meeting with our directors. If that's
Yeah, and I don't know how much longer it's gonna take. If we ran over into 12, rather than eat up more time on Friday, if we ran into 12, we can still cancel the directors and get this done. If you think you can do it in 35 minutes, let's do it.
Sounds good.
Can you, Shelley?
Oh, absolutely.
Okay.
My apologies for going over time. I really appreciate you allowing us extra time to talk.
Okay. So let's not cancel the directors just yet, Romero. Because we should be done. Thank you. So any questions on the policy level proposals? I just have one, and this is on B40-12, the additional environmental health specialist, senior. Can you just give me the cliff notes on that one again? That's a big one, a meaty one.
That was our top priority position. And I think that our request, we had a request for a program manager, but an alternate option of a environmental health senior. And that is the position in 4520 that is needed to help us to provide organizational support to this growing division, plan for succession, provide better grant oversight and staff support, especially to those in the water quality section.
Okay, thank you. And if my seatmates don't have any other questions, we'll get right into the financial plan. Nope, okay, thank you, Shelley.
Robin, do you have our financial plans to project?
Let's see. Let me look.
Shelley, stop sharing your screen.
I sure will.
Is Olivia still on this call?
Yeah, I forwarded them to you this morning. But if there's a specific one, I can send it to you again because I know you got a lot of emails.
Here we go. I think I've just found them.
Okay.
So let's start with the Veterans Fund.
And sorry, Robin, I included TST in that email too. So you have to ignore
That's
those.
okay, Olivia. I can sort through them. No problem.
That's Fund 1200.
Yep, Fund 1200 Veterans. And share my screen. Make this a little bigger for the viewing public. Give it one more thing. I'm also going to just hide these rows because they're not critical. So what you have here is the year that we're in. Just for a little perspective, I should let Shelley and Marcia go through these plans. I was about to launch right in.
That's all right. We really appreciate your help, Robin. So as I think you were about to go into, this is consistent with the document that we went over earlier regarding our expenditures, beginning and ending fund balance. But here you can see what our projected revenues are. So we have, again, a perhaps overly healthy beginning fund balance in 2020 of 586. New revenue coming in through those property taxes at 422,000, and expenditures anticipated at 220. Excuse me. This is our current year, 223,000, with that ending fund balance of 784. And then you can see that we, assumed relative stability in this, even though Mark and I shared that the advisory committee plans to come up with some innovative approaches to spending more money in future years to get more dollars in the hands of veterans and their families in need. So you can see here that this fund balance, as we go forward, continues to grow. So we'll need to have some plans in place to spend some more of those funds.
So if I could just draw attention to a couple of things. The taxes, the revenue source for the tax is property tax. That's a pretty big jump to next year. And then flat in future years, you'll actually see growth. So these should align with what's in Questica, though. So this is not an unreasonable amount of revenue. And then we see on the expense side, expenditures were down a bit in 18 and 19. And when you look back, you see that back in 2015, the fund balance was only about $160,000. And in prior years, it wasn't even that good. So the board at the time took steps to stabilize this fund. What you see now is a growing fund balance. So there's anticipated increase in expenditures for next year. Professional services is where the payments to the veterans can be seen in this fund. And Shelley, is there a reason for the dip this year? Is it related to the slowdown and COVID closing? So you're not seeing as many veterans come forward?
Yes, that's correct. And at the Lacey Veterans Hub, where we're delivering these services, they've had to modify and close down some of their direct services.
So what you see for 2021 is a recovery for that, and then an increase over prior years.
Yes.
So that's 100 and some thousand increase, right?
Yeah, it's pretty substantial, and this fund has room for more.
And has Mark got any explanation about what that extra money is going to purchase, or what service that we're going to get?
He's meeting with the committee tomorrow.
Oh, we don't know yet. Okay. Is that right, Mark? I see you up there.
Yeah, hi. And so on the 19th is when the Veterans Advisory Board meets to discuss ways of spending this balance. But my initial conversation with Gary Walker and Smitty, we want to open up the fund, because there, as Robin said in the past, there was a restriction put on it because people were using it more frequently, individuals. So there was a restriction put on it. And then in 2018, 2019, we revised the policy to allow more services. So that's why you saw a little bump. But this year it dropped because, as Shelley mentioned, we haven't seen a lot of veterans coming in for services. So we're trying to reach out and find out, how we can help, and also expand the amount that we can help them with. Right now, it's twice in a lifetime the fund is able to help a veteran. So we want to open that back up. to multiple times, and also to increase the amount per year.
Yeah, and I see the revenue difference between 20 and 21 is $50,000. Is that kind of reflective of what's going on? Is that what we're up against?
That is a reflection of the increase in property tax. So that's something that we'll talk more about on Friday morning, just when we go over general next steps. But the revenue is going to go up because our property taxes, we had a good year for new construction, let's say.
Okay.
All right, so barring other questions, I'm going to bring up the next one. Fund 1400.
Housing and community renewal.
I'm sorry, it's taking me a moment. I am not seeing Fund 1400 here, Olivia.
Yep, I will find it if you want to pick a different one really quick.
Yep, let's move right to 1500, the big one. My cursor doesn't like having so many open screens. Readable. So 1500. Take it away, Shelley.
Okay. So you can see there's been, in past history, a lot of big changes here. In 2015, you see a large fund balance at the end. That was reflective of the time that the behavioral health organization transitioned out of our department. I want to also add that at that time, we anticipated that we were going to have to give more of that fund balance back to the BHO. We ended up only giving them it was only determined that we owed them $1.7 million. And so that is reflective in the fund balance that carries forward. You can also see that in 2018, that is when environmental health split into its own fund of 4520. So that's kind of bringing us up to date of where we are now. 2020 started off the year with $8.1 million there, and Marcia does have some answers for you as to what that fund balance includes. Marcia, do you want to jump into that now?
Yes, Shelley, I will do my best to try and tackle part of this. Again, we had some conservative information that we were trying to maintain while we were going through the audit from the BHO. So we did keep a higher fund balance, thinking we owed the bulk of it to the BHO. Then there's also the millage funds that are provided for our developmental disabilities program. And we have not spent a large portion of those. So we're working to increase the spending from those millage funds that are being maintained there. We also have the Department of Social and Health Services, over $800,000 that we retain for that. We've also this year we got an additional $50,000 from the State Department of Health for foundational public health services, which we have not been spending a whole lot of due to COVID-19 and redirecting staff that would traditionally be funded out of those dollars. We also have gotten advanced funding to support the Nurse Family Partnership from the National Service Office. So we have funding, again, as those nurses have been redeployed to support COVID-19 in the contact tracing and disease investigation. We have not been able to utilize those funds, and we are fortunate that the National Service Office will allow us to carry those funds into 2021, into 2022 to provide those important services to our young mothers. And so we do have some excess funds built up this year that we hope to start using in the next year or two and reassess what's going on there. We also, with the development of the new environmental health fund, we did a quick analysis on moving funds over to environmental health in 2018, 2019, and it's been on our list to go back and do a further reconciliation to make sure that we have adequately transferred funds to the Fund 4520 environmental health to make sure that they have the appropriate funds transferred to them.
Oh, that, go ahead, Commissioner Mensah.
That was a lot of miscellaneous pieces.
Yeah.
I only have varying understanding of them, but as to, let's just take the first one, as to money we thought we owed the BHO, but turned out we didn't owe the BHO. I don't know how much that is, but that's money that, you know, I would imagine that before we're subsidizing this fund from the general fund, we would want to spend that money rather than shifting it out of the road fund or doing any number of other things that we do. If that's just money we thought was supposed to go to BHO, but it's money that can be deployed. Is that off base, or I'm just throwing that out there as my reaction to what I'm hearing. Happy to hear a contrary point of view if anyone has one.
Hi, Shelley. This is Marcia. I will speak in trying to address your concerns, Commissioner Mensah. It is something that we are wanting to look at as far as making sure that we are not receiving more funds from the general fund than are needed to support our programs. 2020 has just been a heck of a year in trying to find the staff resources to look at all of the funding streams and what we're using and not using. And so that is definitely something we should be looking at to see if there's an amount of county general funds that were transferred to our programs that did not need to be transferred this year.
Fair enough. Thank you.
Anything, Gary?
Well, I would just comment that, you know, part of what you heard Marcia talking about is that this fund receives some of its grant money in advance, which is rare, extremely rare. But since it is that way, you have to hold that money until it's spent on the things that it's intended for. So one of the things that we can work on is to be able, out of that 8.6 million, we can tease out, not today, how much of that really is restricted that you don't have access to spend, so that we can start to determine what the real capacity in this fund is.
Thank you, Robin. That'd be great.
Yeah.
Thank you.
Anything, Gary?
No.
Okay, go ahead then.
Okay. So if you don't have any other questions about this fund, I'll bring up the next one. Cursors. Here we go. Thank you, Olivia. So here we are in Fund 1400. This is your Housing and Community Renewal Fund.
So the main thing to highlight there is 2020 COVID pandemic impact on this fund. So for the better, in the sense that we have received a significant amount of additional revenue to address the COVID response. In 2021, with the additional CDBG funding and the 1406 funds, you anticipate, and we expect that there will probably be even more revenue that will be extended to continue to support people experiencing homelessness and people who are having housing instability due to the economic impacts of COVID-19 in 2021. So this is a program that continues to grow. It's one of your priorities. It's one of our priorities, and you see that reflected here in this plan. Again, it is sensitive in some of the areas to the changes in the housing market, as well as to federal and state funding and what ends up being allocated by Congress and the state legislature.
So one of the things that you may want to note here, 2020 is the explosion year, but even if you ignore 2020 for a moment, look at the actual intergovernmental revenues in 2019 of just under 5 million. That's anticipated to double in 2021. And Shelley, what would you say that that's due to? Is that continuing COVID funding?
Yes, in 2021, it's the COVID funding that we expect to continue on. So that includes things like the Emergency Solutions Grant, which we hadn't previously received, the federal funding, as well as the additional state funding that's been allocated by through commerce programs.
And you don't appear to expect that to taper off in future years.
I expect that it will a bit. I hope that it won't, because I think that our needs, I think we can demonstrate, and we've seen across the state of Washington that this continues to be a major crisis in need. So we hope that the new funding that has come will continue.
And this
Shelley, this is Tom Webster, if I can kind of jump in. Also, because the CDBG and the Emergency Solutions Grant funding, that's under the CARES money, but we do have multiple years to spend this out. Unlike other CARES money that needs to be spent this year, these fund sources do have a 2-year or 3-year time frame in order they can be spent. And we're also anticipating the addition of the 1406 revenue is captured here, as well as some other kind of commerce revenue. So some of the CARES money is able to be spent over the next few years.
Yeah, Tom, the 1406 is on the line item taxes, right? That is the first line item on the revenue.
Yes, thank you for that. Sorry.
Right there.
Right, but I think Robin's question is on point, because if you take the 2020, 2021, let's say, additional revenues due to the COVID-19 response, the intergovernment revenues doubles from 2019 to 2022. So is that an expected, or we know that in fact that is going to be the case? Just curious. I mean, this is good news, obviously. I just want to make sure if that is a realistic expectation.
Yeah, there's so it's a combination of, we also received the Commerce Emergency Housing Grant and a shelter grant program. So there are some new programs coming from Commerce that incorporate this. We are dependent on the federal government with the CDBG and home dollars. So there is some projection and expectation. 2163 revenue has also been steadily increasing. We were fairly conservative in our projections for this year, but we're seeing 2163, which are document recording fees, continue to remain strong and have been growing over the last couple of years as the fees we're allowed to collect for those have increased. But that long-term projection may be it may be a little bit high and optimistic, but we see a kind of we're hopeful for increased solid revenue.
All right, thank you.
The other thing to think about is, as we monitor this fund, you would adjust what you spend here in grant awards. So it's not like we're locked into something that we're banking revenue on.
Yes, and I would like to add on a little bit more to what Robin just said, in that we kind of took an optimistic approach here, looking at the amount that may be spent in those particular years, knowing that we will have to readjust those. If we spend them, say, all in 2020, then we would have to look at potential reductions in 2021, 2022, 2023, in those out years. And so this is kind of making sure that we have enough authority built into our budget for those potential awards that might be spent over the next 2 or 3 years, depending on the grant period for those years. Because the federal funds tend to give us anywhere from 2 to 5 years to spend, and we don't know how quickly or slowly we will spend those funds.
So the flexible expenditure line item is the professional services, right?
That's right. Those are the grants that go out to the community. Because other than that, everything looks pretty darn flat.
Yeah, the rest of it just, is on point, yeah.
All right. Other questions about this fund? Hearing none, we're gonna move on and take a look at.
Robin, I do have one question. When you say it's kind of like it's going to be flat, but under professional services, from 19, it's 7 million to 21 is projected at 12 million, and I realize we're in 20 we're projected at 18, but that's CARES money. How come by 2022 or 2021 we're doubling, not quite doubling, but that expenditure?
So that is the conversation that we were having, Commissioner, that that professional services line item is where you would make adjustments based on the amount of revenue.
If that other money doesn't come in?
Right.
Okay, good enough, that's fine.
And that's where the grants are allocated to the community.
Yeah. Okay, I just wanted to clarify that. Thank you.
Okay.
This one's a little shorter because the fund was only just established in 2019. This is your environmental health fund that
What's the number?
might have
That's the
concerns about.
4520.
4520.
Yes, so thank you so much, Robin, for introducing this. So the 4520, again, you can see that that beginning fund balance is 2.6 million in 2020 that we started with, projected to end at about 2,700 or 2.7 million, not 2,700. My apologies. This revenue is primarily fees from permits, applications, inspections from our various environmental health programs. This is where we initially, as I explained earlier, we took a little bit more conservative approach, and we have received some more optimistic information about some of those revenues. So you can see that we have some assumptions built in here towards the bottom here. We've also had many of our environmental health staff deployed this year to COVID-19 response, which will give us a little bit of salary savings and some additional retirements and things that we've had in this particular division. I mentioned also that in 2021, we have some one-time costs proposed. And so that includes our contribution not only to that fee study of $100,000, one of our policy level requests, but also our 36% cost share of the Amanda replacement system, which is, I want to say approximately, our portion is approximately $490,000 that we'll need to help contribute in between 2021 and 2022. You also see in expenditures moving forward, the policy level requests that you have before you for consideration. And you can see, I think one of the most important things to point out at this fund is you can see that our ending fund balance is starting to decline here. Again, this does assume that all of the positions that we are requesting, because we feel that they are in need in order for this division and these programs to continue to operate efficiently and be successful, Even with, thank you for highlighting that, even with that, there is a need to reassess whether the fees are appropriate to cover the costs. Each year we have increased staffing costs, we're going to have increased technology costs, so we're going to need in the future to really take a look at this fund more closely and the revenue, ensure that we're sustainable.
Is this projection based on you getting everything that you're proposing under 4520?
Yes, sir, it is. So,
but I think that there's, okay, so the last couple of years you were solvent. The next year, about 1.3, and you said Amanda and the fee study, and then 2022, 2023, 2024, we're about $1 million short. So I guess what I'm trying to figure out is, you're not asking for $1 million worth of new positions, are you? So there's got to be something else besides the new policy asks that's making this $1 million shortfall from 2019 to 2022.
And that is exactly what it looks like, Commissioner.
Yeah, it's salaries. If you see the line item on salaries and expenditures, that's the additional 1.2 million. If you take the 2021, because the one cost is $1.2 million more in salary. So it's all the positions the department's requesting.
Can you review those again? I thought it was a program manager and a food person. That's two. I don't remember $1 million worth.
And that's a temporary food position.
Yes, one of the positions is a temporary food inspector. One of them is a program manager position. And then my next change request for environmental health is an environmental health specialist 1 to help with the increased demand for public records requests and our legal requirements, our policy updates, our technology improvements there. And
I think it's close to 4 additional FTEs that you're requesting, right?
Yeah, that's correct. Thank you.
That's 3. What's the 4th?
I'm sorry, I missed that question, Commissioner.
I counted 3 now. What's the 4th request for new staff in environmental health?
Based on my notes, I have the program manager.
Got it.
The inspector, FTE.
Yep.
Then we have the environmental health staff support increase in records request. And then the drinking water.
That's just a 0.1 position for the drinking.
But all that contributes to.
And then I heard something about a sales tax proposal
Sales tax.
that was going to go along with that somehow.
No sales tax proposal, but we want to reassess whether the fees that we charge are keeping up with our expenses, because we also have personnel costs that go up each year. And this program has many longtime employees. When they retire, we have a significant amount of salary and benefits that we also have to pay out.
The buyout.
Mm-hmm.
How long has it been since these fees were studied or reevaluated?
Some of the fees each year are escalated based upon the consumer price index, depending upon what the fee is. In terms of a comprehensive study like the one that we are proposing that includes other departments, I do not know how long that's been. Maybe Art could chime in to give some more historical perspective on that.
And it's been, I want to say 2004, but it might have been updated in 2008. So the base big comprehensive fee study that was done it's well over 10 years. And since then, as Shelley's indicated, we've done cost of living increases. And then there was a 10% adjustment a few years ago that you did when we shifted to Fund 4520.
All right, thank you, Art. We're not going to make up $1 million in fees, but I just want to know what how long it's been antiquated.
Yeah, and the salary differences for those FTEs that we're talking about is about $400,000.
Okay.
So it will be helpful if it's $400,000 to have an understanding as to why jumps $1.2 million in salaries.
I'm curious, it looks like 2020 is not the budget, it's your actual projection for this year, which I appreciate. And would you say that you have a lot of vacancies in this part of your department this year? That's driving the cost down. So, and possibly a lot of extra help that you didn't bring in this year.
2019 actual is 2.5.
Yeah, even if you take 2019, it's still at $1.1 million increase.
Yeah, it is huge. So we'll need to unpack this and bring back answers when you deliberate later in November.
And also just suggestion maybe in terms of the timing, since the fee increase study the fee study is going to be coming up next year if the board approves it. Wouldn't that be the time in which the board, after the fee study is complete, to determine what the level of the staffing is? It's just a question. You don't need to answer that now.
Just on priorities 6 and 7, there was sales tax request mentioned to fund that. What was that about?
6 and 7. What are you looking at?
Priority 6 and priority 7.
And what document are you looking at?
On the policy level proposals. And then
6 and 7, those are TST.
what's that?
TST. Treatment sales tax. You will hear that in more detail on Friday.
Okay.
Okay. So,
We covered IT replacement.
that is a super small fund.
Tiny, yeah.
That is, I mean, it's a reserve just like your IT reserve. So if you'd like to spend a few minutes on that, I will bring it up.
I don't need to. I don't know if my seatmates do, but we're about 2 minutes from the.
No.
That's a small fund.
Oh, I don't need it.
Okay, good. Very comprehensive. Good grief.
It is a large and complex department.
It is. And Marcia, I appreciate your time on vacation chiming in here and zooming in. And you too, Art, your help. Good job, Shelley.
Now she can actually go get a margarita.
Yeah, have one for me too.
There you go. Enjoy yourself, man. Safe travel. All right. Thanks, Marcia.
Thank you so much, commissioners. Thanks for allowing us extra time, and we're happy to follow up to answer those additional questions that you have and provide any more information that you need. Thank you.
Thank you. Thank you, Shelley.
Thank you.
And Robin and all your staff as well, Olivia and such. Thank you. And we're going to zoom out of this now and get in with the department director.
That is correct. So thank you.
Get about 3 minutes.
Before you shut the Zoom off, I just want the board to know I'm going to come around looking for your score sheets. Hang on to public health because you'll probably want that when you look at treatment sales tax on Friday. But I'm looking for all the ones that I'm missing, so I'll see you this afternoon.
They're on my chair. Thank you.
Thanks, everyone.